will not comply. We will not comply. We will not comply. We will.
Regardless of what you think about the Affordable Care Act, it's now here, passed by Congress 3 years ago and now upheld by the Supreme Court. One of its most important provisions is about to go into effect. Circle October 1st on your calendar. That's when millions of Americans without coverage can begin enrolling in subsidized plans in what are known as health insurance exchanges. Yet surveys show most members of the public are totally confused about what's involved, how they work, and how they go about signing up. This hour, KCPT goes on location at the Kauffman Foundation, where we bring together more than 100 citizens and experts who we've charged with making sense of it all for you. With us is Sheldon Weisgraw, who heads the Kansas-based nonprofit Health Reform Resource Project. Also with us is Bridget McCandless. She's a physician and medical director for the Shared Free Health Clinic of Jackson County and the brand spanking new CEO of the Greater Kansas City Healthcare Foundation. Ryan Barker is director of health policy for Missouri's largest health foundation, the Missouri Foundation for Health. Also with us, Linda Shepard, director of healthcare policy for the Kansas Insurance Department, and Carrie Hall, president of Benefits by Design, a health insurance brokerage in Overland Park. He is also the host of the national syndicated radio show, America's Healthcare Advocate, heard locally on KMBZ Radio. You know, there's lots of questions about what the Affordable Care Act means to specific groups, whether it be young people, seniors, small or large business. But what also about different types of groups, like those who are already working but don't have access to health insurance now by their employers? Now, it turns out my colleague, KCPT's own special correspondent, Sam Zeff, falls into that group, so we are using him to test the system. Sam?
Nick, right now I get my health care coverage through COBRA from a previous job, but as most know, COBRA doesn't last forever, so eventually I'm going to have to dip into the healthcare exchanges in Kansas. But I was wondering, could I save some money right now with Obamacare?
So to help figure out if people like me can save money under the Affordable Care Act, we headed to Topeka to the State Insurance Department. And who better to ask than Insurance Commissioner Sandy Prager?
I think people are going to be pleasantly surprised at when you factor in the subsidy, and I think 60% of Kansans are going to be eligible for some sort of financial assistance.
Now, Kansas and Missouri are among 26 states who've said they want nothing to do with Obamacare, thus forcing the federal government to set up the exchanges. But while many Republicans are suspicious of Obamacare,
I'm sure behind my back I'm vilified.
Prager is not. In fact, she's a big fan and even helped write part of the law.
I think it's the right thing to do. I think this country is long overdue with having a healthcare system where everyone has access to services.
So she asked Neil Warman to set up a website with a little guy named Alex to answer Obamacare questions and, more importantly, to see if we can save money. 2 quick notes here. Warman has worked for the state since 1979, and I've known him since my first reporting job, back when I looked like this. And also, there's no Neil Warman equivalent in Missouri, but we'll get back to that. So how's Obamacare looking for a small businessman now covered by COBRA?
So let's do me. Put it in Johnson County.
Okay, we'll scroll down to Johnson County.
Household size of just me.
Okay, that's what it defaults to.
Annual income. Now this is the modified adjusted gross income, correct?
That is correct.
Modified adjusted gross income. You're going to need to know that, so we're going to come back to that. So let's put in $46,000 for modified adjusted gross income.
Got it.
Nobody younger than 20. My age is 56. Let's see what we got. So no tax credit for me.
No tax credit available for you. The premium is $395. That is estimated.
Now, that's a little less than I'm paying now, but until the actual plans roll out on October 1st, I don't know what that $395 buys me. Now, there are 4 levels of coverage: bronze, silver, gold, and platinum, platinum being the most expensive. None includes dental. That is an added cost. And that modified adjusted gross income, Yeah, you're not going to find that on your tax return. The MAGI, as they call it, is your adjusted gross income with some things added back in, like tuition, student loan interest, or contributions to your IRA. But a lot of people will get generous subsidies.
I'll use my home county of Washington County.
I understand the county seat is Washington, Kansas.
It is, and this is up northwest of Manhattan. I'm going to say it's a household size of 4. I'm estimating the income to be $38,000 a year.
This family has 2 children younger than 20. The parents are 30 and 28. Their monthly premium, an estimated $630. But with a tax credit, they would pay only $143 a month.
I have to tell you, I'm surprised at the IRS tax credit here. I mean, that's very substantial, especially on somebody with an income of $38,000.
I think many of us have been surprised when we put the calculator together and saw what these credits could be for some average families in Kansas.
But what about the Show Me State?
Turns out you can't do this kind of research here in Missouri. You see, they passed a law which severely restricts what people like Neil can do. Cross the state line, and the ACA becomes, well, Voldemort care. The law who must not be named.
I would love to have the opportunity to have our resources and our capabilities unfettered by rules that prohibit us from accomplishing our mission.
Gary Zabarak runs the health department in Clay County. Essentially, the law says nobody who works in government in Missouri can help federal officials set up or promote Obamacare. Even the spokesman at the Missouri Insurance Department wouldn't speak about it. So Zaborak can hand out brochures, direct people to websites, or get them to people who can help. But hundreds of uninsured people a week come to his clinic in Liberty, and a lot of these folks are eligible for Obamacare and the significant subsidies that come with it.
This is really, really important, Sam. These folks are hardworking people, okay? They're not on the dole. They're not sitting at home just collecting checks from the government. These are hardworking people. They have 2, 3 jobs, and because of their circumstances at work, they're not provided with workplace health care insurance opportunities like a lot of Missourians are.
There's something to be said for a point of purchase. They're here.
Right.
You've got them here.
Right.
And if you were able to counsel them and sign them up here,
Sure.
that's got to be better.
Absolutely. Absolutely.
Now, the reality is, though, Sam, that most people, though, get their insurance from their employer. Are they going to be affected at all by this?
No, if you're getting your insurance from your employer, you're not. And in fact, most people do get their insurance, health insurance, from their employer. But the fact is, there's a lot of jobs being created in the United States right now, Kansas and Missouri, that are part-time jobs or jobs that don't have benefits that come with it. And Obamacare, the health care exchanges, are for those people because they're going to get significant subsidies from the IRS.
Sam, thank you very much indeed. Panel, I mean, the vast majority of Americans, the vast majority of people in our metropolitan area watching this program, in our audience, I mean, they are working Americans who get their benefits from their employer. They don't have to worry about this, do they?
For the most part, they don't. Some small businesses will be able to have their employees shop for insurance on the marketplace, but for the most part, if you get insurance from your job, this will not affect you.
Okay, so who needs to worry about the health exchanges? Who is signing up for these health exchanges?
Really people who are uninsured, families who are uninsured, and families and individuals who currently buy their health insurance on their own. In the individual market is what we call it. They may find a better deal using the marketplace because of the subsidies. And then small employers. A lot of small employers can't afford to offer coverage. There is tax credits available for them also offering coverage through the marketplace.
You know, one of the things that I read just recently in a local newspaper was this. It's a lot like Amazon.com, except you're buying health insurance. It's something I think people will be familiar with once they start working with it. Really?
You know, the way I describe it, I've heard it described as the Travelocity or Expedia of health insurance. I think in reality, it's going to be a little more complicated than that. It's going to be more like the TurboTax of health insurance. You're going to need to go to this marketplace with information about your income to see if you're eligible for a tax credit. But beyond that, I think it's not going to be as unfamiliar as people think. I mean, most people are used to using the internet to buy certain products. Medicare beneficiaries use the internet currently to buy prescription drug plans. So I think it's going to be familiar to most people.
But is it going to really be that familiar? When we put this forum together and asked people to RSVP for this event, they could sign on online or call KCPT by phone. Just as many people wanted to call by phone that actually used the internet to RSVP. So that said to us, on this issue, a lot of people don't feel comfortable or don't have access to the computer.
Right.
What happens if you don't have access to the computer or don't feel comfortable using the computer, Bridget?
There's going to be a lot of folks to be able to help answer questions. So real people that you can sit down and ask questions of, those are called navigators. Some of them are going to be located in clinics that you may be going to. They may be in your local hospital. Your local health department may be able to give you information about that. And at healthcare.gov, they're going to be able to help direct you. So if you have access to the internet, they can provide you with a list of those places. But the government's also provided a phone bank, so you should be able to call someone on the phone.
But who are these people? Because for over a year now, we've been hearing about these healthcare navigators. And now we're just around the corner from October 1, when we're going to be signing up for these enrollment in these health exchanges. But we've not seen ads on TV saying who these people are and how you actually do this. So who is actually going to be helping citizens, Linda, through this system? Who is navigating the public?
You know, there are a number of different, what we refer to as assisters, different types of assisters that will be helping folks. And so
how do I as a citizen know who these people are, though?
You know, for individuals who are familiar with an insurance agent in your community, you have somebody you've worked with in the past, they can be trained to sell through the marketplace and help individuals buy their coverage. There will also be these navigators. Information about the navigators will be available on the healthcare.gov website. And I think you'll start to see them out in the field more as they get into get their system established.
Charity. Okay, let's talk about some individual cases right now, and particularly one of the areas that the Affordable Care Act is trying to get people enrolled is among young people.
My name is Mike Hardin, and I just graduated from UMKC here with a master's degree in curriculum and instructional leadership. I'm 25. I'm a few weeks out of turning 26. I just got out of grad school. I'm on my parents' insurance for another, 3 weeks because it's cheaper to pay for a group plan than it is an individual plan. But in 3 weeks, I have to know what I'm doing next because I have to have insurance. And so I guess what it comes down to is what can the Health Insurance Exchange Plan do for me, and what can the new Affordable Care Act do for me?
We know that the Affordable Care Act allows young people to stay on their parents' plan until the age of 26. Well, this is somebody now who's going to be aging out of that. So what options are available for this UMKC student who's going to be aging out? Kerry?
Well, he can buy insurance on the open market, or he can see if he qualifies for the exchange. But let's talk about that for a minute. In a study that was released, and it was an article in the Kansas City Star recently, the largest study of premium costs across the country, Alvera Health laid out the statistic that the average cost for a 21-year-old was going to be about $270 a month. Now, the current cost for a policy very similar to that, either on Blue Cross or on Coventry, is about $76.38 a month. So there's going to be a significant rate shock here for younger folks if they have to go out and buy an unsubsidized policy. A 40-year-old, under that same study, would pay a premium of about $330 a month. That same 40-year-old today under Blue Cross is paying a premium of $97.15 for a like policy. So there is going to be a premium increase that's going to be significant, especially for the younger folks because of community underwriting.
Any other options available to this young man? Ryan?
So partially we don't know the rates yet in the marketplace, especially for Kansas and Missouri. They haven't announced them. We have started seeing some of the rates
Why is that, though, when we're just about to start this? How is it that we don't know those rates?
Because the federal government never thought it was going to have to set up these marketplaces in 27 states. And 27 states said, no, we want you to do it. We don't want to do it. So the feds have been scrambling to get this all done. They said early September we would know. Now it's the end of September. Now, some of the states that have been setting up their own exchanges, California, Colorado, New York, we've started to see rates come out. Now, not talking young versus old, but just in general, those marketplaces have shown decreases from the current market from 20%, 30%, 50% less than the current individual market. Now, that doesn't mean young people are going to see that much of a cut, but I will say for young people in the marketplace, if you're young and healthy, one, you have to use the marketplace to get the subsidy, and two, there is a catastrophic plan. So there's platinum, gold, silver, bronze, and catastrophic. You have to be younger than 30 years old to qualify for the catastrophic plan that will just cover major medical. So we expect that to be even less expensive.
But Ryan, you said he'd have to go through the health exchanges. Isn't it possible for an individual just to go, as they would now, to a private health insurance company? Can't they just do that, and that's proof of insurance?
Yes, you can still purchase plans outside of the marketplace on your own in the individual market.
Okay. Is it go back to questions? Yours, please, sir.
Hi, I'm Walter LeConte in Lee Summit, Missouri, and I'm wondering if a 60-year-old person that's uninsured enrolls in, I'll call it ACA, the Affordable Care Act. What happens when they're 65? What will the transition period look like when they're eligible for Medicare?
It should be easy. The good news is the federal government, they've definitely got Medicare down to a science. And so several months before your 65th birthday, they will contact you, you will get information, and then when you turn, you've got your card, you're ready to go. The transition should be seamless.
They will contact me?
You bet. They know where you live.
Of course they know where you live.
That's a comforting
Finally, though, some good news.
There you are. Wow. Again, I mean, and that's another example of how Medicare really isn't changing. And so whether you have a private insurance or not, when you're eligible for Medicare, the process will be just like it is today.
Let's talk about businesses. We've heard that large businesses with over 50 employees are exempt from the mandates required under the Affordable Care Act for another year. Does that mean they have absolutely nothing to worry about?
We have approximately 220 employees and 5 cities here in the Midwest. We are going to, what you'd say, stay the course. We have always offered a very good medical insurance plan for all of our employees. I've heard horror stories of these predictions that monthly insurance premiums, whether you're Blue Cross or Coventry or Humana, whomever, that some of these smaller groups are expecting to double their insurance rates over 2 to 3 years. You know, that's going to have a huge impact on employers. Traditionally, we've felt good if we had less than a 10% increase. If you have 25, 33, 50% increase in a year, that's a huge, huge number. You multiply it out, our gross insurance, medical insurance premiums for 2014 will be a little less than $1 million. So you start adding 10% to that, 25% to that. We're talking very, very large numbers that the employer eats, the employee shares, or you pass it on as inflationary price increases, or a combination of those three. So it's big, big numbers.
220 employees, a large employer in this metropolitan area. That's somebody, though, still worrying about this Affordable Care Act, and we're told, well, they don't have anything to worry about for another year, Sheldon.
Well, what you're talking about, and talking about another year, there are some responsibilities that large employers have under this law. The vast majority of large employers already provide insurance to their employees, just like this one does, and they are expected to continue providing that insurance, and if they don't, they will pay fines. The enforcement of that law has been delayed for a year, so that's what you're talking about. This business owner was concerned about huge price increases There's nothing inherent in this law that will have the 25 or 35% price increases that he's talking about. And so we will see how it plays out. But again, there's nothing here that for a large business that already offers insurance is going to vastly increase their prices.
Kerry. Well, unfortunately, there are some things that are going to happen as a result of the Affordable Care Act. If you have a group of approximately 100 people, you can expect about $29,000 in new taxes and fees. Some of those taxes are the health insurance tax. For a group of 100 people, that tax would represent $19,124. Additional, there's the transitional reinsurance tax, which is another $6,300, and the patient certified outcomes research fee, which is another $200. So those things are going to happen, and they're going to result in premium increases. So you can expect to see premium increases on the group side as a result of these new taxes and fees that are going to be in place. Whether it's 25 or 30%, I don't know, but I can tell you those things are going to happen because they're in the bill.
If you're a large employer.
That's correct.
Okay. Bridget.
You know, one of the things that we can't quantify yet is what happens when we start taking care of people who have been uninsured. And we know that we're passing a lot of costs onto the people who have insurance. And so I think that we could really end up seeing some premium reductions as we take care of folks who are right now passing those costs on. Now, I have no way of knowing what that's going to be, but the next couple of years, I think, really could show that to be some substantial savings in our outlays for insurance.
You're a small business owner with a half-dozen employees. I don't provide health insurance to my workers now. Will I have to under this new health insurance law? Or will it be cheaper for me to pay this so-called tax penalty?
First of all, if you are a small employer, the Affordable Care Act does not require you to offer coverage, and that's if you have fewer than 50 employees. So if you are a small employer and you are offering coverage, that's great, and you can continue to do that. But if you're not offering coverage, there will be no penalty imposed on a small employer for not offering coverage to their employees.
So they don't have to provide health insurance to their employees.
That's correct. Now, there has been a lot of talk about employers dumping their coverage and telling their employees to go to the exchange. Let me give you a little anecdotal evidence if I can. I've taught seminars around the country in New Orleans, in Indianapolis, in Tennessee, et cetera, where I've spoken to just CEOs. One of the things we've done in those seminars is passed out a flyer, a sheet that asks them, what are you planning to do as a result of the Affordable Care Act? Will you dump your group health insurance, and will you tell your employees to move to the exchange if you have less than 50 employees, or even if you have more? Interestingly enough, we have not had one employer say they would dump their health insurance. So we see that the employers intend to keep the policies in place and deal with the cost increases as best they can.
Just to clarify, if you have more than 50 employees, you're a large employer, and you are required after another year to provide health insurance to your employees. If you're under 50, a small employer, you do not have to provide health insurance. However, isn't it the case that there are some generous tax credits available for small employees under the Affordable Care Act to provide health insurance to those employees? And are we seeing that happen, and are they really that generous?
Yes. I mean, so that tax credit, it's for small employers with less than 25 employees. It's been around since 2010.
Okay.
It will increase.
Sheldon?
So the small employer credit is exactly as Ryan described, but it is even a little bit more limited. It is for employers with an average employee salary of $50,000 or less. And so that limits it somewhat. And I think there hasn't been a lot of take-up because there has not been a lot of positive marketing and publicity about this law. A lot of small employers just simply don't know it's out there.
I just want to do the reverse side of this. Okay, so we talked about the small business owner.
You're one of those workers in that small business. You're in your early 30s, single, and without health insurance. Does the Affordable Care Act provide you with any new and, more importantly, cheaper options for getting coverage?
You're subject to the individual mandate, so you're required to have an insurance policy as of January 1st of 2014.
Okay, so you have to do that.
Or pay the penalty.
Or pay the penalty.
But you do not have to buy it on the exchange.
Okay, so you can go to an individual private plan and do that.
But you can't get a tax credit unless you buy it on the exchange.
Okay, so now it's all becoming crystal clear. By the way, we did talk with one of those small business owners this week.
I'm Bob Akers. I'm the Executive Director of Surplus Exchange. We have 13 employees here, and we do offer insurance to all employees. I don't know how you can keep politics out of a question like this. You know, my real concern at this point is, you know, we do all of this work and we get this thing started, and then you have a change in leadership, and they decide to start. You know, you constantly hear someone, you know, put me in office and I'll repeal Obamacare. You know, how expensive would that be if we start to go down that path, and then you have somebody just merely because the other side thought of it, they decide they don't like it? Because that seems to be where we are politically. If one side thinks of it, even if it's a good idea, the other side hates it, and vice versa, regardless. Good ideas are being thrown out simply because, you know, my side didn't think of it.
Should he have those concerns, Kerry Hall?
I don't think there's a chance this is going to be repealed. I just can't see it. I don't think there's enough votes on either side of the aisle to make this happen. It certainly isn't going to be approved by the president. So I think, you know, that's a discussion that's been had and it's over with. The Affordable Care Act is reality today, and we need to adapt to it and do what we need to do to move forward.
And I really liked his point actually about how much would it cost to repeal this. We have hospital systems, healthcare providers that have spent the last 3 years adjusting their practices, changing the way they do business. There's new models of care that hospitals and providers are trying out and shifting the way they work. If all of a sudden they have to shift that again because this all goes away, we're talking about billions of dollars for them to shift back to a different model and change again. So I think that's something we often don't think about.
In Sam's piece, which we started this whole program with, he's going on the computer and trying to navigate this whole system. I want to just make this very clear to our audience, again, as we try and work this out in our minds, because it does get complicated. Is the advice from you as our think tank of experts here that we, at the end of the day, go to healthcare.gov? That's the website we should be going to. Yes?
Yes.
Okay. Before we even get there, what information should we be bringing next to the computer with us?
Income information is the biggest piece. You have to know your Social Security number.
So we need our Social Security number and we need our income information. What else do we need before we even get to the computer, Sheldon?
Need your, if you have a physician that you currently see or a hospital that you want to make sure you'll have access to, you want to know what those.
So those need to be next to our computer. Anything else before we even start logging on that site?
To create an account on the marketplace, you have to have an email address.
Okay.
Very basic, but and a lot of people don't.
How
so
many
that
people?
Is step one.
Who doesn't have an email address in the audience? Okay, so we do have some people who don't have email addresses. So that is a problem. And so what did we say the advice was for people who don't have email addresses, who don't have access to a computer? And in Kansas City metropolitan area, we know 1 in 5 people don't have access to a computer.
We have seen a lot of interest in Missouri, and maybe in Kansas also, from public libraries. And most of public libraries do have internet access.
But if you still don't have an email address, you're still going to have to create one.
You get the phone number
Okay.
from healthcare.gov. So the librarian can help you get the phone number so you can actually make a phone application.
All right, so we have our information next to the computer. We're ready to go. We've clicked on and we've typed in healthcare.gov. And what types of questions, other than our regular name, address, what other information are we going to need to make this work?
There are 4 pieces of information that will determine what kind of plan you're eligible for and how much it will cost. And that is where you live, how old you are, because I believe Ryan talked earlier about older people will pay as much as 3 times as much as younger people.
And somebody said before we started this forum how disgraceful that was, why they thought that people who are older should be paying 3 times as much as younger people. So why is that, first of all, very briefly?
That's because older people tend to use more healthcare services than younger people, so it costs more to insure.
Is that fair, ladies and gentlemen? No? Okay, all right, fine.
Okay.
So we got the age, so we've got where you live,
age, how many people are on the policy? Is it for you as an individual or is it for your whole family?
Okay.
That's number 3. And then the last one is, do you use tobacco?
Do you use tobacco?
If you're a smoker or you use tobacco, you may pay as much as 50% more for your health insurance policy and none of that 50% is eligible to be covered with a tax credit.
Is that fair, ladies and gentlemen? Yeah, we think that's fair. That's okay. Okay. All righty. So you enter that information, and what happens then?
You will see the plans being offered in the exchange, in the marketplace, the insurance companies, the different plans they're offering, and the prices, and you'll be able to compare.
And do you then pay for the plan right there and then?
You can go ahead and
pay
start
for
to process your enrollment right at that point in time, and can establish an account so that you can start make your first
And
month's
so you can
premium.
actually pay the premium right there and then at that point.
Well, a couple of different...
It's almost as easy, it seems, as becoming a member of KCPT. Is it as easy as that?